Greetings to one and all. Comprising about 10 million people are called dual eligible for both Medicare and Medicaid. They are the elderly who are the beneficiaries under the Medicare and Medicaid programs, and they comprise majority of the so-called beneficiaries. It is an ongoing healthcare policy concern in the United States. 73% of all beneficiaries that are dual are living in a long-term care facility. 60% of the dual eligible population are frail adults, and 40% are with disability under the age of 65 years old. Delivering care services and support to this group is an ongoing and the greatest challenge in the healthcare delivery system. These people are considered the poorest and sickest of all Medicare beneficiaries. Issues like problematic quality of care in institutional settings and fragmentation of service coordination in community-based settings are the two major specific concerns in the long-term care system where dual eligible elderly are being taken care of. However, since 1970s, the program called PACE, or the Program of All-Inclusive Care for Elderly, has been operating. It was running for decades with the goal to address with the ongoing issue about dual eligible population with regards to healthcare delivery system and increasing healthcare expenditure. This is composed and managed by an interdisciplinary team which is composed of a physician, nurses, social workers, and therapists. It is a logical approach to healthcare under Medicare and Medicaid services through a single point of delivery that focuses dual eligible frail elderly with chronic care needs. In general, PACE program has significant outcomes and positive impact to the dual eligible beneficiaries, which includes greater adult day healthcare use, lower skilled home health visits, fewer hospitalizations, fewer nursing home admissions, higher contact with primary care, longer survival rates, increased number of days in the community, better health care, better quality of life, greater satisfaction, and better functional status. However, the PACE program was running in an outdated system and it is not yet implemented in every state because of lack of knowledge nor expertise to develop and maintain the infrastructure required to operate, and the challenge of the back office tasks of claims processing, data submission requirements established by the Center for Medicare and Medicaid Services. That is why on 2016, proposed updated regulations were made to the old PACE program rules and carefully reviewed and aimed to bring better outcomes into the healthcare delivery system and to be implemented all throughout the nation. Further, the proposed revised regulations for the program, the legislation known as H.R. 652 or the Comprehensive Care for Seniors Act of 2019 was introduced to direct the Center for Medicare and Medicaid to promulgate the long overdue updates and revisions to the regulations of the Program of All-Inclusive Care for Elderly or the PACE program. Therefore, I want to express my full support to this legislation because of the following reasons. Why the new PACE program regulations needs to be passed. First is to address the issue about lacking geriatric physicians, as the new rule allows non-physician medical providers to practice within the scope of their licensure. Secondly, it would result to lower hospitalization rates, readmissions, and potentially avoidable hospitalizations. Third, there would be lower expenditure cost for hospitalizations. Another one would be there would be increased compliance oversight and was recognized as one of the significances and a key to prevent fraud, waste, and abuse. Additional provisions were added in the personnel qualifications and training as well. Also, this promotes the elderly participants' autonomy and liberty to stay at home while receiving care services, which suggests features of successful care coordination programs as proven by evidence. Economically, it will bring lower down healthcare costs for every dual eligible participant, as the participant's overall health is being approached holistically, as care for elderly with multiple health problems is being provided by one single phase organization that composed of an interdisciplinary team. This describes a compelling reason why the said bill needs to be passed. It is with strong advocacy for the dual eligible elderlies who are considered as the sickest and poorest people. Together with 15 other co-sponsors of this bill expresses their support and belief in the dignity within the later stages of life. That these elderly people have the right, not only as a patient, but most importantly as a human, to receive the best quality of care. Being a nurse and an advocate for our patients, especially the frail elderly, I urge you, our honorable legislators, to consider the bill that was introduced. This will address the ongoing issue about the delivery and quality of care for our dual eligible elderly. As the challenge of this increasing demand of healthcare to the said population, it is very timely and appropriate to implement the long overdue new regulations of the program of all-inclusive care for elderly, with its goal to enhance the delivery and quality of care to our dear, frail elderly. Thank you and God bless.